Healthier Together, sponsored by Regence Blue Cross Blue Shield of Oregon.
Well, the leading cause of death in Oregon and Washington is cancer. And in this week's Healthier Together, Christine Pitawanich brings us a new, clearer focus on fighting cancer in Oregon.
We're actually really excited about this. So the state of Oregon hasn't had a comprehensive cancer control plan since 2005. This is something that most states, in fact, I believe almost all states have.
That's Dr. Jacqueline Shannon, Associate Director of Community Outreach and Engagement for OHSU's Knight Cancer Institute. She says the comprehensive cancer control plan formed by the Knight Cancer Institute and Oregon Health Authority zeroes in on challenges in the state, gathering data, everything from highest occurrence of cancer to how communities are experiencing cancer differently.
And that can be used to help guide work, bring our resources in a singular direction so that we can really make some significant impact.
The plan focuses on 4 priorities: breast cancer, colorectal cancer, lung cancer, and liver cancer. The area of focus, the HPV vaccine.
Each one of those, we saw they were either very common, or in the case of liver, it's not actually that common, but it's going up quickly. It's going up faster in Oregon than it is in the rest of the country.
Why is it going up so quickly in Oregon?
We don't actually know. Heavy alcohol consumption is a risk factor.
And she says rural areas experience cancer differently.
Pretty much across every cancer we look at, we see higher incidence and higher mortality in the rural communities. And again, we don't have the exact answer why. Is it that people aren't able to access screening? Is it some sort of different risk factors? Is it access to care?
The hope? To gather organizations across the state to share information and focus on specific challenges together in order to make an impact.
Cancer is the #1 killer in Oregon, and it's really important that we begin to think about this not just in terms of how do we treat cancer, but also how do we prevent cancer, how can we detect it early so that it is most treatable, and then how do we help support individuals who are moving beyond cancer.
Christine Pitawanich, KGW News.
Well, this year, the Oregon Health Authority is forming task forces to develop strategies and goals for each focus area. If you'd like to be involved, we'll have that information in our story on our website. And for more Healthier Together stories, just go to kgw.com/healthiertogether.